At the outset, I'd like to thank Dr. Shashikumar for giving this opportunity to share about the topic responsibility of management. The intent of this chapter is to encourage the governance of the eye care organization in a professional and ethical manner. When an organization follows this chapter perfectly, it will comply with all the applicable regulations and its leaders ensure patient safety and risk management. This chapter has 3 standards and 17 objective elements. ROM 1. The responsibility of the management are defined. 1A. The eye care organization has a documented organogram. This organogram should clearly define the hierarchy of the institution, the line of control, functions at various levels, and very importantly, incorporate the various committees into it. The organogram must be transparent and made accessible to all its employees. 1B. Those responsible for management support safety initiatives and quality improvement plans. The reports of the safety and quality improvement committees are shared with the management and funds are allocated for corrective and preventive actions. 1C. The management defines the rights and responsibilities of its employees. They must be in consonance with the existing labor laws. 1D. Those responsible for governance address the eye care organization's social responsibility. The organization must be involved in outreach programs, and they must certainly support national public health programs like the NTCB. 1E. The organization is registered with appropriate authorities as applicable. For example, the Clinical Establishment Act. The head of the institution will be expected to give an undertaking in a standardized format during the inspection. ROM 2. The eye care organization is managed by the leaders in an ethical manner. ROM 2A. The leaders make public the vision, mission, and values of the eye care organization. These statements must be displayed prominently, and preferably translated to the local language. ROM 2B. The leaders establish the eye care organization's ethical management. There must be transparency in handling complaints, grievances, research, and clinical care. The Code of Medical Ethics 2002, published by the Medical Council of India, is a good guide to follow. ROM 2C. The eye care organization discloses its ownership. This disclosure can be in its registration certificate, in its quality manual, or on display boards. 2D. The eye care organization honestly portrays the services which it can and cannot provide. For example, an eye care organization, if it advertises that it provides retinal services, but it does not do retinal surgeries, then it must clearly communicate to its patients that that particular surgical retina is not handled by this particular organization. 2E. The eye care organization honestly portrays its affiliations and accreditations. ROM 2F. The eye care organization accurately bills for its services based upon a standard billing tariff. There must be the same charge for all patients in the same bed category for the same surgery or procedure. ROM 2G. The functioning of committees is reviewed by the management for their effectiveness. The purpose of the committee, the frequency of its meetings, any remedial measures that the committee may recommend monitoring of all corrective and preventive actions must be done by the management in a timely fashion. ROM 2H. The ICARE organization has a formal documented agreement for all its outsourced activities, which include monitoring the quality of the outsourced services. This must be done at least once a year. ROM 3. Management ensures that patient safety aspects and risk management issues are an integral part of patient care and hospital management. ROM 3A. The organization has a designated individual to oversee the hospital-wide safety program. This can be a safety officer or a hospital administrator. ROM 3B. The scope of the program is defined to include adverse events ranging from no harm to sentinel events. All these events must be clearly defined, and what constitutes a near miss, a no harm, or a sentinel event must be known to its employees. ROM 3C. Management ensures that appropriate corrective and preventive actions are taken to address safety-related incidents. This can be done by the safety committee. Root cause analysis must be done and the root cause should be identified. ROM 3D. Management ensures internal and external reporting of system and process failures. There must be a contingency plan in place if such failures occur. So we find that in this chapter, the role of the management is clearly defined to ensure that the practice of modern medicine is ethical and professional.